I'm Dr. Terry Weaver. I have the honor of being the Dean of the College of Nursing at the University of Illinois, Chicago.
And I'm Lauren Fraser, Dean of the Columbia University School of Nursing, and we want to welcome you all to this exciting event. Nursing belongs on the Hill. A conversation with Representative Lauren Underwood. I know I speak for both of us when I say I could not be prouder of the collaboration between our schools that has made today possible.
So I guess should I go ahead?
I couldn't agree with Dean Fraser more. Also, we want to extend our thanks to Illinois' own Representative Underwood, who will be with us today. The past year has called the world's attention to the impact nurses have on patient care, and Representative Underwood reminds us of the powerful influences nurses also have beyond the healthcare setting. So without further ado, please welcome today's hosts, Dr. Charles Yingling, Associate Dean for Practice and Partnership and two-time alumnus of the University of Illinois College of Nursing, wave Charlie. And Charlie is actually at the Arena One, the Credit Union Arena One, on campus, overseeing our students giving vaccinations today. They do over 1,000 vaccinations per day, and the faculty volunteer. So that's where he is right now.
And also Dr. Patricia Stone, Centennial Professor of Health Policy and Director of the Center for Health Policy at Columbia University School of Nursing.
Thank you, Deans, for the introduction.
Yes, thank you so much, Dean Fraser and Dean Weaver. Very, very excited about today, and can't wait for everyone to hear our conversation with Congressman Lauren Underwood. I want to thank everybody that has submitted their questions to the Congresswoman in advance. We're going to try to get to many of them. I want to let you know that we have over like hundreds of people that have signed up for this, and they represent people from both the UIC community and Columbia University, as well as people across the nation. And one of the things that I liked most was some were proud constituents. So that made me feel really good. But many friends, students, alumni, and faculty members. Representative Underwood is running a little late today. We're expecting her in about 10 or 15 minutes. So that gives us some time to introduce her work. And just, I think probably everybody know that Lauren Underwood was first elected in 2018 to represent Illinois' 14th district. She is the youngest African-American woman to serve in the U.S. House of Representatives. And in just a few years, she has become known for her commitments to affordable, accessible, and comprehensive healthcare, as well as her dedication to health equity.
And for Representative Underwood, also makes her voice heard as a member of the House Committees on Veterans Affairs and Appropriations. And she's also a member of the Future Forum, committed to the concerns of younger Americans, as well as the LGBTQ+ Equality Caucus and the Gun Violence Prevention Task Force. But perhaps most notably, Representative Underwood is co-founder and co-chair of the Black Maternal Health Caucus. If that sounds familiar, it's probably because it was in the news just last week when the caucus introduced to Congress the Omnibus Act of 2021.
Okay, thanks. Charlie, when you're speaking, we just got in the chat. It's a little difficult to hear with your mask, so you'll have to speak up.
I will speak as loud as possible. Thank you. I apologize for that.
That's okay.
I may relocate away from other people so I can demask a little bit.
Whatever you're comfortable with.
Thank you.
But just speak loud with the mask.
Sure.
So the Omnibus Act is a beautiful package of 12 bills that seek to really change maternal child health. And you know, and really to better understand the maternal health crisis that's happening in the United States. It's incredible in the rich country that we are. We are one of the only developed countries where maternal child health is decreasing. We have worse outcomes, and we have the worst outcomes of any developed country. In 2018, maternal death rate for Black women was more than double of white women, 37.1 deaths per 100,000 lives, and that's compared to 14.7 for white. And it's also more than 3 times the rate for Hispanics. And it's not income and education. Those are not the only things that make a difference. This is for everybody. You know, I mean, it's really hitting Black mothers hard. Charlie, do you want to?
Yeah, we were speaking this morning about, and let me ask, I'm hoping that you can hear me better without my mask. I'm keeping an eye out. If anyone comes, I will remask. We were speaking this morning about the Omnibus Act, and you had noted something interesting regarding the organizational proponents of the act. And there were some interesting omissions and some interesting inclusions. And I wondered if maybe you could speak to that a little bit. I thought it was quite notable what you had observed.
Sure. So looking at the Omnibus Act has about 190 different organizations that support it. It's a very long list endorsing it. All the major nursing organizations are there. American Nurses Association, American Academy of Nursing, the Midwifery Association. But what was, ACOG has endorsed it, so I misspoke on that, I double checked on that. But the AMA hasn't, you know, and it really takes a coalition, and I, you know, was wondering why the AMA is not putting their name to that. The other thing that I noticed was one school of nursing did. I've already got it from my dean. We'll be endorsing it as soon as we can. We'll find out what the process is. We'll ask Jack and Lauren how we do want to endorse it. We think it's very important. And I'm sure UIC will be endorsing it too.
If I could sign for us, I would do it instantaneously, but get some higher level support for that. One of the questions while we're waiting for Representative Underwood, I do want to remind anyone who's just arrived or who arrived recently, she's running a little bit late due to commitments. So we're talking a little bit about the work that Representative Underwood is doing, particularly around health equity. One of the questions from Edie is about how can frontline providers address racial disparities in healthcare? And I think this is something where I am sitting today at Credit Union One Arena in Chicago, which is where we are as a university and a health system administering COVID vaccines. I feel like this is the prime example of racial inequity in healthcare today, of access to vaccination and access to the array of platforms that it takes for a person to get scheduled for a vaccine. And so I wonder, Pat, if you could speak a little bit to that, about what you think we could be doing differently with regards to COVID vaccine access for communities that don't have ready access to the technology that's often required to schedule these vaccines.
Yeah, Charlie, that's a really, really important point. We know that COVID is hitting people of color very hard, and it's really shown a light already on the health inequities that we have, and it's just hopefully some good things will come out of the pandemic and we can make some progress. But it's hard to sign up for a vaccination. And if you're doing it from a phone and you don't have an internet or you don't have a computer and you're just doing it from phone access, it can be, and if you have to worry about your data and how much you're spending on your phone, these can be barriers from so much. So within our own communities, we need to see what we can do to break down these barriers, because they are real and they exist. You know, we really need to get out in the community and get these people signed up for their vaccinations.
And I would say that's been, to speak to that specific question of what can frontline providers do, I think, Pat, you hit it. There is, and speaking just to COVID vaccination at this moment in time, the key thing is we can build equity into our vaccine distribution process. And to me, what that means is to say that, yes, we have online platforms and 800 numbers you can call to schedule. But if you don't have 3 kids who can all step away from their jobs for the day to try and get through on that line or get through on that platform, you're further disadvantaged from access to something that is so life-saving at this moment in time. So what we can be doing is that deliberate outreach to communities that need this vaccine the most, which here in Chicago, as is the case nationally, is our communities of color, largely located on Chicago's south and west sides. And I can speak for our own faculty practice. We are doing very, very deliberate telephone outreach to candidate patients so that they're not stuck navigating a computer system or navigating an 800 number in order to gain access to those vaccines. And I think that is a small thing, but it's something we can all be doing to help people with that one of those many disparities that we're facing right now.
Yeah, and we're doing similar things at Columbia School of Nursing, or the medical school. The campus is right in Washington Heights, which is very much it's a Dominican population. So it's the largest Dominican population outside of the Dominican Republic. And so we're doing as much as we can within the community to get the vaccinations, and also, as you know, in Bronx and Queens, which have been hit so very, very hard. And Charlie, I did see one thing. They're still having a little hard time hearing. Yes. So.
I'm going to try a different approach. Does this make a difference? I'm changing to my laptop mic. Hopefully.
Yes, that makes a big difference, I think.
Sorry. Thank you. We were, for anyone who's not in Chicago right now, we had an extraordinary snowfall last night that left a number of our volunteer students and faculty snowed in their homes. And so this is why I am here rather than in my office on campus, because I was one of the faculty who was able to get in here. There's a great question that someone just brought up about trust. And this is something I know that nationally we're talking about vaccine hesitancy as being something that's more common in communities of color. And that's with good reason. These communities have been mistreated in the past and have appropriately lost trust in our system. And so one of the things that we talk about, this isn't going to be a commercial or a public service announcement. It's going to be a series of one-on-one conversations to try and rebuild trust. And so I'm curious for you, Pat, when you see that question about what might health workers do to help reestablish trust with minority populations and public health institutions, what do you see as being one of those strategies?
Well, I think it really has to do with, the mistrust is just is part of the systematic bias that's in our system that we need to get, work to do and get over. And I think the biggest part of that is going to be through community leaders and engaging with community leaders, sort of like participatory action research, where you really get into the community and the community leaders understand, and you ask them, how is it best to get this message out to the community of interest? And when you participate as equal partners, you'll go a lot further along. And we really, as healthcare workers, we need to be there asking the community leaders, whether it's church leaders or people in the schools, who are the leaders in the community that you're trying to reach.
Thank you. I would like to pivot for just a moment and just remind anyone who's just arrived, we are waiting for Representative Underwood. She was delayed a bit. We're expecting her hopefully within the next few minutes. So we're just talking a little bit about some of the policies that are important to the representative. And one of the things I did want to bring up is the role of nurses in policymaking and in politics. And as we all know, Representative Underwood is a nurse. And this is why so many of us are so proud to be here today to hear the Congresswoman speak about her journey through the nursing profession as well as into politics. And Pat, as the policy expert, I am curious to ask you, what do you see for students who are with us, students or earlier, even mid-career nurses? What do you see as specific actions that they can take outside of their nursing career or within their nursing career to become leaders in policy or leaders in politics?
Nurses we work very hard to teach all our student nurses the importance of policy. And policy can be at the level of the unit in the hospital. It can be, hospital-wide. It can be regional and your local health department or school board. It can be state, and it can be federal, and then it can be global. So we need to get nurses involved at every level, because it really is how you can have the most important impact when you can change policy and have effective evidence-based policy, which is what Congresswoman Underwood is doing. It's really, really important. Should we talk a little bit about what's in the Omnibus Act?
Yeah, because when she arrives, I imagine this is something we want to talk to her about. So could you give us a little bit of background about what, I want to maybe paraphrase a little, and then I'm going to ask Pat to dig into a bit of the details. What I find so affirming about this proposed legislation is that it acknowledges that health is not exclusively in the hands of healthcare providers, but health is in the hands of urban planners, of transportation program directors, of housing experts, that all of those social determinants that have far more impact on health outcomes than we ever could in our 10 to 15 minutes with a patient are built into this. And so I'd like, Pat, if you could kind of get into some of those details of how this shifts the focus from being that from healthcare providers to the larger picture.
Yeah, no, I really love thinking about the Omnibus Act, because it does have, look who's here that can talk to us about the Omnibus Act.
Representative
timing.
Underwood arrived on cue. Thank you, Congresswoman Underwood.
Thank you. Nice to see you all.
Thank you for being here. Nice to see you too.
Thank you.
So, Congressman Underwood, can you tell us about this wonderful legislation that just got introduced last week, the Omnibus Act?
Yes. So the Black Maternal Health Omnibus Act is a comprehensive set of legislation to address every dimension of the Black maternal health crisis that we face in the United States. Now, this legislation was not meant to be duplicative of other legislative endeavors. So as you all know, Medicaid is the key to solving so much of this maternal health crisis in this country. Expanding postpartum Medicaid from 60 days postpartum to 12 months postpartum is something that has been contemplated in several pieces of legislation. Therefore, it is not in the Omnibus. What we have in the Omnibus are bills like the Perinatal Workforce Act that seeks to, expand the number of nurse midwives and certified midwives and doulas and obstetricians, and making sure that there really is provider choice for every birthing person in this country, no matter if you're rural or urban, no matter if you speak English or not, no matter your race or ethnicity, whether you're in a tribe or not, right? Like, we know that birthing people should have choices and feel supported throughout their delivery and postpartum period, and it is, and prenatal care, obviously. And so that's an example. We have, it's 12 bills now. So there's 3 new bills within the Omnibus. And so it was originally introduced last year in 2020 with then Senator Kamala Harris. She's now in the White House, off to bigger and better things. And so now we have Senator Cory Booker with us as a partner. One new bill is related to climate change. So last summer, JAMA put out an article saying that extreme heat and air pollution had some, very negative impacts on birth outcomes, but it was especially acute for Black moms. So we were like, that's got to be in the Omnibus. And then there's 2 bills related to COVID. So one is the Maternal Pandemic Response Act, Maternal Health Pandemic Response Act, with Senator Elizabeth Warren, because we know that pregnant people have not been involved in the vaccine trials, and many of the treatment trials. We're seeing that there is real confusion among the community on, whether or not folks should be vaccinated, immunized, whatever. And then there's the Maternal Vaccination Act that Terry Sewell has introduced, which is much broader around this issue of maternal vaccinations at large. The idea is we've got to take action to stop this disparity from persisting. The United States leads the world in maternal mortality. Black women are 3 to 4 times more likely to die nationwide, regardless of income, education, right, prenatal care, insurance status, whatever. In Illinois, Black women are 6 times more likely to die, and it's been like this for decades. This is an opportunity to save lives, and we're really excited about the bill.
If it's okay, Representative Underwood, I'd like to ask a follow-on to that, specific to Illinois. As you know, Mercy Hospital serves Chicago's South Side community, and it recently sought permission to close. That was denied by the state, and subsequently last week, Mercy declared bankruptcy. If this proceeds, it will leave a maternity desert on Chicago's South Side. I want to highlight some of the work that we're doing with 2 amazing nurse midwives, Carrie Stewart and Janine Logan. Carrie and Janine are nurse, you're familiar with them, leading a project called Melanated Midwives, as well as the Chicago Southside Black Birth Equity Project. And what they're seeking to do is establish a freestanding birth center on the South Side, as well as increase representation of people of color in the midwifery profession. So to Carrie and Janine, and to us who are trying to move on this, could you tell us perhaps what in the Omnibus Act might help us achieve this aim of establishing a freestanding birth center, but also diversifying the midwifery workforce, as you've referenced?
Yes, okay, thank you. I just want to say, first of all, thank you for taking on this issue. It's so important because we have a crisis in maternity care deserts all across the country. There's 7 million people of childbearing age who live in counties, so women who live in counties with limited access to maternity care or who don't have access at all. For example, one of the counties that I represent here in Northern Illinois, suburban Chicago, doesn't even have a hospital. And so we know that the crisis is not limited to rural areas. There are urban areas in Chicago and other cities around the country where hospitals and obstetrics units are closing, leaving moms with nowhere to go, which is why I honed in on this Perinatal Workforce Act within the Omnibus. That's Gwen Moore's bill, which provides robust funding to both grow, increase the numbers overall, but also diversify the perinatal workforce, ensuring that no matter where a mom lives, she can access maternal health care and support from trusted clinicians, doulas, and other peer supporters. So there's funding for birth centers within that bill as well. So as you're doing this work here in Chicago, know that we're gonna do everything we can in Congress to get these resources and to fund the initiatives and make sure that folks have the choice that they need and deserve. That's really my objective. Now, I would say more broadly, as you know, there are many barriers to this work. And so I think most importantly, we have to be persistent and relentless. and we will certainly keep you posted on our progress in the Congress on this issue in particular.
Thank you so much for your leadership on this. Thank you.
Yeah, I totally agree with Charlie. Thank you so much because it's really amazing, your leadership. Congressman Underwood, we have, our participants and our audience today is many student nurses, people involved with both the universities, and some proud constituents. They said that's what they are, proud constituents. Yeah. But can you speak a little bit about your journey from nursing to politics and how you got there besides persistence?
Oh, sure. So this is really what happened. When I was in high school, my mayor started a program that allowed high school students to join local boards and commissions. And so at 16, I got a 1-year appointment to the Fair Housing Commission in my town. And I was curious, didn't know much about housing, and just learned a lot. So got reappointed my senior year. So by the time I was heading off to nursing school, I went to the University of Michigan, I had this really unique but very rich experience in local government that I loved, right? And I was curious, I was opinionated, I loved being like in the know and being able to tell other folks things that they didn't know. And so I just thought it was gonna be a hobby. Well, the honors program at Michigan, we had a required course at 8 a.m. on a Monday, okay, second semester, freshman year, policy and politics in nursing and healthcare. And what that course did was it taught me that there was this field called health policy, and I could combine my interest in nursing and public health with my interest in politics and policy making, and I was hooked. So I spent the summer after my sophomore year interning on Capitol Hill. I found a paid internship with the Congressional Black Caucus and interned for Senator Obama. And then after my junior year, I went down to the Centers for Disease Control in Atlanta and did an internship program looking at environmental health and injury prevention and some of the disparities at that time. And then I went off to Hopkins for graduate school while they were working on the ACA. The ACA was being debated and drafted in the Congress while I was able to be a fellow with, the faculty will know this organization, the American Association of Colleges of Nursing, AACN. I had like a 9-month fellowship with them to work on the health reform bill, that the stimulus bill back then, the American Recovery and Reinvestment Act, and all of our great Title VIII nursing workforce initiatives. And so basically, I was interested in policy while all my classmates were doing, mother baby or, hustling to get those really competitive internships in ICUs. I was like, I want to DC, I'm going to change the world. And I was encouraged to do it. That's what's so amazing about it is that, I have been so blessed to be mentored by open-minded, progressive thinking, expansive lens nurses who understand that we have to be part of policymaking. And so when I ultimately finished school, I was a career federal employee. I worked to implement the Affordable Care Act for 4.5 years. Everything that the Obama administration was getting sued on related to the ACA was in my portfolio, including the contraception stuff. And you can imagine that was very contentious. I then joined the Obama administration to work on public health emergencies and disasters. We did Ebola, we did Zika, we did the water crisis in Flint. And then I stayed until the last day, and the administration didn't want to help the Trump team take away healthcare coverage from people. So I decided to return home to Illinois, started working for a Medicaid managed care plan, Medicaid, and, had the crazy idea to run for Congress. And healthcare was the #1 issue. People were like, oh, bless your heart. And I was like, no, for real, we deserve better. And we won. And so now I get to do this work. Youngest Black woman ever to serve in Congress. Now there are 3 nurses in the Congress, me, Cori Bush, newly elected from Missouri, and then Chairwoman Eddie Bernice Johnson, who chairs the Science, Space, and Technology Committee in the Congress.
It's so wonderful and so motivating. And you had the bug early. Mm-hmm. What advice do you have to me to try to get the bug in our student nurses?
Yes. What's so interesting, and even in our clinical curricula as BSN students, we interact and intersect with policy in so many ways, we just don't call it out. And so I think for a lot of my classmates at the time, they didn't really understand the work that I was doing and how it related to their clinical practice, right? Like the patients that they were seeing, the barriers that were in place. Every single thing that we do has been decided whether or not that's in our scope, if you can use that medication, how you document in your electronic health record, right? All the disclosures that folks have to sign. I mean, somebody made those decisions, and chances are we weren't at the table for them. And so helping student nurses, even from the very first clinical foundations course, understand where policymaking fits in, I think is so important, and to make that accessible to them. Because a lot of people think that the only way that they can make a difference is to do like I did, right? And quit your job and run for Congress and then do that full time. The majority of policymaking, particularly in the healthcare space, is happening at your county board of health and the people who oversee the health department. Like a clinician who is an expert and lives in that community should be serving on that body. I mean, all of you live in a community that has a health department. Yes. You'd be excellent. And I know that we're all very busy and this is not the time to add on new projects. And I get that. But, there is such a rich opportunity and such a need for our expertise that it's not even political. I know a lot of us say, oh, I'm not political. I just take care of my patients. Or that's for somebody else to decide. Or my favorite is, my husband makes those decisions for our family. Right. And we roll our eyes, but this is a real thing. And I think that, we have to encourage, particularly student nurses, to begin to reconcile their personal politics which very well may be conservative leaning, with the work that they're doing and advocating for their patients, families, and communities, and how you can still vote and like for whoever you like personally, but be the fiercest advocate and champion of those lawmakers who care about the issues that are important to you in your clinical practice. And that is a conversation that I believe is like that next level that I would love to see in our schools of nursing around the country.
One of the questions that just went through the chat is how should people, nurses, our audience, connect with legislatures? What's the best way for people to connect with you? You're a nurse and you understand this, but
yes,
other places we don't have nurses. So what's the best way for them to connect?
Okay, so each of you has one member of Congress and 2 senators, which means you have 3 people that you need to be in touch with all the time. Yeah. So number 1, figure out their phone number, their email addresses, okay? And you need to reach out and just introduce yourself, ask for a meeting. This week, I'm at home in Naperville. Every member of Congress is basically at home in their district this week. Why? Because President's Day was yesterday. All the senators are home in their district. Why? Because President's Day was yesterday. This is a great week to request a meeting with your members of Congress, okay? And even if you can't meet with the member, meet with the staff. Do not take that as an insult, because the staff most times know more information. They'll be way more candid with you, and you can have a very productive 20-minute conversation. The key is to offer yourself as a resource, as an expert, and tell your stories. You would be shocked at how much policymakers don't know about the foundations and the basics of the work that you do. They have no idea of all the expertise housed at these schools of nursing and your centers for excellence. And invite them for a tour. Invite them to come visit. And if the member can't come, invite that staffer to come. People have no clue, right? And the other thing to remember is that in general, nursing is financed by nurses. We pay for our education. We take out debt to pay for our education. Physicians, largely, their education is paid for or heavily subsidized by the taxpayers. And so policymakers are much more familiar with medical education because we fund it. They are far less familiar with nursing education and scope of practice and what we do in communities, because that's regulated at a state level. Mm-hmm. We have a lot of work to do with individual members on the federal level. So don't be shy, just ask for the meetings, be in touch. And here's my last tip. If there's a member that is not your member of Congress that you need to correspond with, maybe you don't like a vote that they took, or you need to let them know how you feel about an issue, go ahead and send that email, but know that the computer is probably going to weed you out. You got to go analog, okay? So get out your stationery and put a stamp on it and put it in the mail. They may not write you back, but I can guarantee that they'll get it, okay? We all are just, we get a lot of correspondence from our constituents. And so these computer systems are very good at figuring out that you don't live in the district.
Very good tip. Thank you so much.
Yeah, thank you. If I could pivot for a moment, Congresswoman, a number of the questions that people submitted in advance are around your positions on health equity. And obviously the COVID pandemic and the Black Lives Matter movement have held a mirror up to the health inequities that have always existed in the country. And I wonder if you could talk a bit about your legislative priorities that focus on advancing health equity.
Okay, well, this is so important. This is like foundational to the work that I've done throughout my career. And it's amazing, I became a nurse in 2008 to be able to see the progress that we've made. And so while there is this robust national conversation where people are using words like equity and justice and disparity correctly, right? And they understand the difference between equality and equity. And it's just like mind blown, right? Like people get it now more broadly. We cannot lose sight of, the progress that's happening before our eyes. So in addition to the Omnibus, I touched on postpartum Medicaid expansion. That's really important. The politics on Medicaid expansion has changed a lot in a very short amount of time. So this is a policy that passed the House of Representatives unanimously. So remember the days when the Affordable Care Act was so toxic that you couldn't get a Republican on the record to say anything reasonable or nice, right? Like all these states around the country have continued to not expand Medicaid, but in the Congress, we understand how important it is to save moms. And so I'm very optimistic, right? That is a sign of progress to me. More broadly, beyond maternal health, you know, cost, out-of-pocket cost has been such a barrier to people being able to get the healthcare that they need. And so we have been working very hard to lower out-of-pocket costs, particularly around premiums. I am very much a champion of investing in state and local health departments. I mean, public health has been systematically disinvested in over the last 10 plus years. And we're seeing the consequences with this pandemic. And my fear is so many of the routine public health actions are not happening. And so we're going to have our vulnerable populations with even worse health status on the other side of the pandemic because that local resource has been sidelined. And I really believe that with the COVID vaccine, we've got to support community-led vaccination efforts. I like to use the words flood the zone, right? So there are communities that are hardest hit, where our essential workers live, where they have high rates of COVID diagnoses, high rates of COVID deaths, and those folks need to be vaccinated. And, you know.
Could I ask you, Representative Underwood, only that we were speaking about that a little. I'm actually at the Credit Union One Arena right now at UIC, which is our vaccine site for the campus and the community. So our students are downstairs. You know, I think we'll exceed 1,000 vaccines today. But here we are in the Illinois Medical District,
yes.
not in these communities where those frontline workers live. And I'm curious to just hear when we talk about equity of making sure that people have a leg up to gain access, and we were speaking earlier about not relying on online scheduling platforms as the sole way to access these vaccines. I'm wondering if you have any thoughts about what we could be doing differently to reach out, to not to just reach out, but to deliver vaccines to those communities that are worst impacted by this pandemic.
Right. So we got to go to the places that people trust. So often people in these communities don't have a healthcare provider. They just don't, because the healthcare providers are not in the community. For the communities where you do have a federally qualified health center, they need to be the messenger, right? Partnering with pastors or, you know, the community organizations that help with food, that help with housing, that are just trusted messengers on services. Those folks need to be centered and given permission and resources to do the work that they know how to do to reach these populations. I think that there has been, you know, people want to talk about like community pharmacies, like that's fine, but people can't afford their prescription drugs. Like people are not hanging out at the pharmacy. I mean, the Biden people really like this pharmacy idea. It's cute on paper. I don't know how that's really going to work because people, I mean, folks don't go to the pharmacy like that. And the pharmacy, I mean, I don't know how that's going to work. So I think that like the mobile units that are staffed by people who already do the work in the community. So not like fill in the blank university coming in with their shiny van and nobody really trusts them. I don't really think that that's a good idea. But there are people who are trusted in those communities that can be great partners.
Thank you. Thank you.
Thank you. I understand you have to leave us soon. Your time is very precious.
So long-winded.
No, your energy is just fabulous, and it's very exciting. Is there any closing thoughts that you want to give us or advice, you know, about how to improve health equity and social justice? Okay.
What I would say is that we are the experts. We have the tools. There's, you know for yourself if you have personal work to do in this, you know, anti-racism context, right? If you want to learn more and how to be a better ally, if you want to understand the role of bias and the implicit biases that you have, if you want to know more about, you know, rooting out explicit bias in your healthcare system, right? Those are reasons to take another class or to do some, you know, deep level research and introspection and, whatever. But do not think that you are not credentialed properly to do this work. Do not let that be an excuse. We are agents of change. And the great opportunity that we have as nurses is that there are so many of us, and we are working in such diverse clinical settings that we interact with our communities in such a meaningful way every day. And so each interaction that you have, every time that you can make a small change to orient your clinical practice or your health system or your department or your clinic to equity and justice, every small step that you can make will pay off. Do not delay doing the work because you think that you're not qualified. And I just want to say I think for people who are really deeply committed, but also intimidated, there's this interest in like centering maybe Black voices or other people of color. And, in the absence, right? Because we know that we don't all have diverse workplaces. In the absence of having that diverse person, right? Because it's not their responsibility to do this work for you, by the way, right? In the absence of having that diverse person, it doesn't mean that the work shouldn't happen. It's up to you, right? So we are leaders. It is up to us to lead and make this happen. And I just want people to feel empowered to do that work in their own environments.
Yeah, we're doing so much, we're trying so hard at Columbia, and we're trying, and nursing is leading the way, it's social justice and health equity is the mantra, and it started, and we are leading the way on our whole medical campus. So
yeah,
that, but there's so much work to do. There's just so much work to do. Your relentless and persistence is something that keeps on coming back. It's how important that is,
And just because you haven't seen it done before doesn't mean it's not possible. I've never seen anybody like me do most of the things I've done in my career. But it doesn't mean that we're not qualified. It doesn't mean that we're not welcome. It doesn't mean that we won't be successful. Sometimes you just have to be the first.
Yeah.
And
I love this message, particularly that you're giving to our students or early career nurses.
Yes.
That what is stopping you? There's absolutely nothing standing in your way of stepping into a leadership role, such as the one you've stepped into.
But also, like our mid-career nurses, we know that the majority of nurses don't discover policy until late in their career, right? Once they transition out of the bedside, right? Because we know this sort of happens generally, 45, 50. And they get into some kind of like administrative role and it's like, oh, wow, right? Well, in that moment of enlightenment, as I would say, don't lean all the way in. Whenever you feel that spark, you are not too late to have impact. That's what I want folks to know. And you don't have to go get another master's or whatever in order to be impactful to do it. I mean, we love highly educated nurses, obviously, but it's not a prerequisite.
To move.
Representative Underwood. Oh, I'm sorry, Pat.
I was just going to say that there's some people that wanted to know about your work on the Veterans Administration Veteran Affairs Committee. So if you could just speak that.
Okay, so I serve on the House Veterans Affairs Committee. I love that work. My work is focused on two areas. One is improving gender-specific care. The VA has been really inconsistent in providing care to women and across the country, particularly creating safe spaces. There's been a lot of internal data that we've been seeing around harassment within VA clinics. And so this idea of having like a protected space for women's healthcare, you all may not know this, but right now the VA is caring for folks who are, post 9/11 generation, and then like these incredible women who served in the Cadet Nurse Corps in World War II. It's across the lifespan. Okay, in an environment where there just is not the robust resources in every region to offer the highest level of care. We need to improve that, and we know how. It's just about making those investments and having leaders that are willing to commit. So that's one area. Everything from, looking to the evidence, which is what I love to do, where, we found an article that said that if the VA dispensed year-long contraceptive coverage, we'd have better outcomes and save money. Well, hello, we called the VA, like, why haven't you adopted this? They're like, you haven't made us. So we wrote the bill, you know? And so like doing stuff like that, and then suicide prevention and mental health. So this is an area where I believe that we've got to be more creative. This is not just let's study it. There is a robust treasure trove of evidence about clinical interventions that work. And we need to set up an environment within the VA to do that. So one of my latest initiatives is around lethal means training, which there has been this huge like backlash among my Republican colleagues, despite the Trump administration supporting it, because the evidence is there. You know why? Because you have to be explicit about firearms. We have 22 veterans who are dying by suicide every day. Half of them are not connected with the VA for care, which means they are isolated, they are alone, and they are suffering in our communities. That also means, though, that half of them are coming into the VA and walking out, and they're still dying by suicide because they did not have an effective intervention. And we've got to be better in those clinical interactions to make sure that we are providing the care that will save lives, and lethal means training is part of it. I think the status like 60 to 70% of the suicide deaths are due to firearms. And so we cannot run away from the role of guns, particularly with this population who knows how to use them. They have guns in their homes, and the preponderance of suicide there. So that's the work I'm doing. I obviously love it. They know I'm not shy. And, you know, we will be relentless to save lives for sure. So if you all have ideas or want to send us papers or whatever, please, please do. My website is underwood.house.gov. There's a place to send us an email. And I'm pretty sure Jack from my team is who you've all been working with, yes?
Yes.
Correct, yep.
Okay, so you all can share Jack's info for those who are experts and, you know, want to be in touch.
Thank you so much. This has just been very, very good. I know your time is precious, so we appreciate the time that you gave us, and we're very excited, and it's very inspiring, so thank you.
It's been an honor. I can't wait to see you all in person next time. Please take good care of yourselves. And you know, I want to be a partner in your work. Yeah. So let's not make this the last time that we're chatting.
If you know anyone who needs a COVID vaccine, send them over here, Congresswoman Underwood. You're back in the district, so.
Listen, too much to say about that.
We'll save that for our next session. Thank you so much for your time today, Congresswoman Underwood. We are so
Thank you so much. I know that Congressman Underwood has to be going, and you know, we don't have much time left. Charlie, do you have any last thought?
Yeah, I just wanted to call out, the precision in the Congresswoman's language is something that I find very striking. And I particularly to nurses who are with us today, word choice. She's very consistent about offering services to pregnant people rather than pregnant women. Her trans inclusivity is really remarkable, and we know her leadership on sexual and gender minority health is evident in something as simple as her word choice. That many different kinds of people can be pregnant, and not all of them identify as women. And I appreciate her leadership and on that. Her precision in language around her work with veterans. I feel that I'm inspired as always when I hear her speak, but I just wanted to call that out because I think that's something that she didn't explicitly speak to, but she has a track record of leadership in that area.
I think the idea that we need to really be careful with our words is very important for all of us to be, especially in this time when there's so much hurt going on. And it's a good point. I think I just want to recognize, we will post Jack's email, which is her staffer. She also, if you looked at her website, she has some openings for interns, so people that want to get involved, or maybe you just want to volunteer if you're in her area. And then I also would be remiss if we didn't thank all the people that made this happen, because it wasn't Charlie and myself, but it was Lauren, Sharon, Reva, Linda, And
I got to give a shout out to Liz Miller and Steve George at UIC, who were
Yeah.
integral in putting this together. And of course, our mutually beloved Dr. Tonda Hughes, who is Professor Emeritus of UIC and current faculty at Columbia. So in many ways, the bridge between our two.
It truly was her bridge that got us together. And so we're very excited about that. And of course, we want to thank the support of our deans. So thank you all. I think this has been a terrific event. It will be recorded so you can send it to other people. It'll be on both of our websites. So please share it. And I hope it was helpful to you. So thank you.
And thank you, Pat. This was a pleasure working with you on this. And as you shared, the recording will be available on both of our schools' websites within the coming weeks. So please feel free to share it widely. And because I am tasked with putting out our social media messaging, if you are a Twitter user, please send us your thoughts on today's events. We are at UIC Nursing and Pat is at Columbia Nursing. You can also find us on Facebook, Instagram, and LinkedIn. So please tag us in any posts that you make about today. And that pretty much concludes for this session. We hope again to meet with Representative Underwood or Representative Bush, or there's some great nurse leaders that we could follow on with, and I hope we can accomplish that.
Yeah, thanks a lot.
Thank you, everyone. Have a great rest of your day, and thank you for being here.
Snow
yes, if you're in Northern Illinois, good luck to you as you get out of your driveway or home.
Bye-bye.
Bye-bye.